There are two important points in the definition of any addiction, including drug addiction: the so-called reward and reinforcement. Reinforcement. In general, drug abuse is the use, usually by self-administration, of any drug in a manner that deviates from the approved medical social patterns within a given culture. An addiction is a pathological state characterized by an irresistible need of a certain substance, which is not required for survival, but which evokes feelings of comfort and pleasure. This is what we call a reward. The state of addiction is characterized by mental and physiological dependency, which makes it impossible to function normally without the substance, which in turn leads to repeated usage, reinforcement, and abuse, with serious health and social consequences. In early research, addictions were believed to be substance-associated only, drug, alcohol, and so on, and the understanding of addiction was as follows. So this is the person. And this is color and the chain connecting person to some substance. Here is a substance. Later research revealed many similar conditions not tied to any substance in the common meaning of the word. For instance, internet-related obsessive behaviors, gambling, and etc. These conditions didn't include physiological symptoms associated with drug or alcohol addiction, but research showed clinical, phenomenological, genetic, neurobiological, and other similarities between them. Obviously, the very concept of addiction needed to be redefined, and this has happened in the course of the last decades. In DSM-5 and in ICD-10, addictions are now described as disorders associated with more than just certain chemical substances. The latest definition includes gambling and other conditions, at least as a suggestion for future research. It is even more important that they now include the concept of dependent personality as the basis of a possible cause of addictive behavior. How does it work? You remember reward and reinforcement? Let's use a picture of human brain I have drawn before. There are several regions in the brain which are important in the pathophysiology of addiction. I marked them with a pink color here, 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 and here. In these regions, cells, special biochemical compounds and genes are taking part. Cells, compounds, and genes are taking part in various normal processes. These compounds regulate and mediate behavior responsive to natural rewards after activities such as sex, food, exercise. Obviously, they take part in responses to drug abuse rewards in a similar way. Well, too much reward cause an alteration or malfunction of these compounds and genes expression in those regions of the brain, and consequently these cause repeated acquisition of these rewards, so that brain dysregulation can result in a reinforcing effect. This trying to show the dysregulation, which leads to reinforcing effect. They are focused on keeping dysregulated brain processes stable and seeking more and more reward. What is the main factor causing brain dysfunction described above and resulting in drug abuse and addiction? Well, that's a good question. can see this mechanism leading to a disorder substance use, to substance abuse. And by substance, I mean not only drugs or other chemical substances. Remember what I have drawn before. Substances are used more and more, gradually causing more and more harm, and finally the user loses control over the use. But how and why does usage become abuse? Why do some people seek multiple rewards and others don't? So, the last decade of research leaves no doubt that dependent behavior has not an external origin but also an internal one. A person becomes dependent because he or she has a psychological predisposition, and it is common in all addictions, in drug addiction, gambling, gaming, sex addiction, and some other. They are all shaped by individual personality traits, and the person possessing these traits can find an appropriate object or subject of addiction without any outer help. Research have shown that these personality traits in drug addicts, alcohol addicts, and other addicts come in a cluster, which means they are most likely to develop all together in one addict. This resulted in a hypothesis about the supremacy of dependent personality over addiction itself. Many distinctive traits of a typical dependent personality were discovered, like immaturity, lack of self-sufficiency and self-support, unwillingness to take responsibility, a passive attitude, avoidance of difficulties and discomfort, lack of control, and incapability to make choices and decisions, and need of close relationship with others for survival. Some of these come from family background, otherwise can come from the environment, some come from genetic predisposition. And together they act as predisposing factors for addiction, especially in the context of life strains. Immaturity rooted in family trauma increases the chances that the individual will be passive and unwilling to take the responsibility. Individuals who are passive because of immaturity always feel depressed and feel insecure and unfree, and more likely to avoid difficulties and discomfort, which in turn promotes risk for some other difficulties, and so on and so on and so on.